in terms of mechanism of action, the target for ibrutinib is BTK, Bruton's tyrosine kinase, and it turns out that protein is right in the middle of the B-cell receptor signaling pathway. And now more and more evidence suggests that pathway is a real driver of the growth and proliferation of leukemia and lymphoma cells across a variety of malignancies. And that's why targeting that protein is so important in disrupting the growth signal from that pathway. And as I said, that pathway is very, very active in driving the growth and proliferation of lymphoma, of chronic lymphocytic leukemia, of mantle cell lymphoma, and maybe even in other tumor types that we're looking at, for example, in multiple myeloma as well. So in terms of a very important target, we feel it's probably the most important target for hitting B-cell malignancies with a drug like ibrutinib that's working quite well at knocking out the signaling from that pathway. And that manifests itself in early evidence of activity across several tumor types. So certainly what we've already reported at ASH in December the past year, looking at the role of single-agent ibrutinib in both CLL and mantle cell lymphoma, where we're seeing in heavily pretreated patients high response rates and now very durable responses, including in patients who have had very poor prognostic factors, for example, the 17p deletion in CLL, where those patients typically become resistant to chemoimmunotherapy, have really no other options, and we're seeing excellent response rates and durable responses with ibrutinib in that patient population.